Hey guys, you're welcome back to my channel. I am Dr. Chidi. It's been a while I put out content here as regards Oman, and I think it's nice that I'm having to do this again once more. Today, I'll be sharing some information about the Prometric exam as relating to non-doctor health practitioners, okay? And this includes people like pharmacists, nurses, optometrists, pharmacy assistants, radiographers, physiotherapists, medical laboratory scientists, all these category of people. I'm going to be sharing vital current information as regards your Prometric, the pass mark, the duration of the exam, and the number of questions you should expect to answer in the exam. Many people are unaware of these facts, and so they are confused. Some do not even realize the nature of the exam that they are going to take. So for a start, I'd like to start by saying that the Prometric exam is a medical exam in your field, okay? So they are not asking you English, mathematics, or any of those esoteric stuff. The questions you're going to be expected to answer in the Prometric exam are subject matter specific, which is to say, if you're a nurse, you'll be answering questions as relating to nursing profession. If you're a physiotherapist, you'll be answering questions relating to physiotherapy. If you're a radiographer, the same thing. So all the health cadres, all the health professions or professionals will be answering questions that are directly related to their own field. So you don't have to be worried about what kind of question are you going to be asked, okay? These questions are going to be things in your field. So the import or the main purpose for which I'm doing this video today is to share important information as to what you should be expecting vis-a-vis the cutoff marks, the number of questions and number of hours your exam is going to last, to help you come in the frame of mind or get the frame of mind that you need to face the exam successfully. So I'm going to be starting with pharmacists, okay? Now, for pharmacists, you're going to be answering 150 questions within 3 hours, okay? And your pass mark is 60%. So calculate that. It will help you to find out or to figure out how many questions you need to answer correctly to be able to pass the exam. In this case, you'll be needing 60 over 100 times 150. So you're going to need to answer 90 out of the 150 questions correctly to pass the exam as a pharmacist, okay? Because your pass mark is 60%. Your exam is for 3 hours. The total number of questions is 150. Now, for pharmacy assistants, the passing score, as in your pass mark, is 55%, okay? Now, you also have 150 questions and 3 hours to take the exam. For nurses, the nursing profession, you have 100 questions to answer in 2 hours, 30 minutes, okay? 100 questions in 2 hours, 30 minutes, and your pass mark is 50%. For nurses, your pass mark is 50%, which means you need to answer 50 questions correctly to be able to pass. Now, for radiographers, you have 150 questions to answer in three hours, and your pass mark is also 50%, okay? Now, optometry, your questions is 100 questions to answer in 2 hours, 30 minutes, and your pass mark is 45%, 45%, okay? Which means you have to answer 45 questions correctly to be able to pass the exam. For physiotherapists, you have 150 questions in 3 hours, and your pass mark is 50%, okay? So you need to answer 75 questions correctly to be able to pass the exam. So for medical laboratory technicians or scientists, you have 100 questions and 2 hours, 30 minutes to answer the question, and your pass mark is 50%, which means you need to score at least 50 over 100 to be able to pass the exam. Now, this information is not from my head. It's directly from Prometric, okay? And can be confirmed and verified by anyone who is interested. However, in the past, we have noticed, especially with the doctors, that sometimes the Prometric pass mark is at variance with the requirements of employers for hiring you, okay? And so for those who came for the Zoom meeting I held some weeks ago, for people that wanted to get on this pathway, I shared some relatively higher scores with them. And I think you should continue to target those scores so that peradventure an employer sets a higher bar for you to join his hospital, you would be ready. And so even though the scores here are showing 60, 50, 45, and 55, all of those stuff, I'd encourage you, if you're a pharmacist, to be aiming at 65% and above, okay? And for all the other professions, aim at something close to 60 and above. That is going to keep you safe from any of the variances that can occur or that can arise during this process. That said, I'd like to say I wish you good luck in your exams, and as you start this process, you're going to find favor, and your goal of relocating to Oman will be accomplished sooner than later. And it's important to state again that Vidan Solution is available to assist you in this process. If you're confused, if you're in doubt as to how to do these things, what is involved, what the process is like, I have some videos out here on YouTube as well that can help you to get in perspective as to the requirements. However, if you still need detailed guidance in this process, feel free to reach out to the contact in the description below, and you would be guided for a fee, obviously. Okay. Now, we can help you in so many ways, or Vidan Solutions can be of help to you in so many ways, starting from guiding you towards the Prometric, showing you where to source the preparatory materials, helping you with your data flow process and all of those, you understand? Guiding you, you have the police clearance. There are a lot of requirements you need. We have videos like that out there too. And we have people that work in partnership with us to guide, especially Nigerians, and other countries. We can still guide you the much we can. But for Nigerians, we have fully understood the process that you're going to take to come to Oman, and we can guide you accordingly so that you don't get misled or fall into the hands of fraudsters that will rip you off your money without giving you value for it. Okay, so thank you very much once again for watching this video to the end, and I hope to see you soon. Bye-bye.